I'm going to talk about the prevalence of hepatitis C, HIV, syphilis, and risk behavior among prisoners in Skopje, Macedonia in 2014. Why prisoners? Because prisoners are considered as population at risk for HIV, bloodborne diseases, and sexually transmitted infections. They are also population at risk due to risk behavior such as injected drug use and risk sexual behavior. They are settled in the prisons, and the prisons are closed settings with specific features of overcrowding, of poor nutrition, limited access to healthcare, continued drug use, unsafe injected practices, unprotected sexual activity. Additionally, many of the prisoners became for marginalized population with risk behavior even before imprisonment. And finally, the prevalence the prevalence of HIV is higher, and for hepatitis C, the prevalence is even higher in the general population. According to the Ministry of Justice, in Macedonia, there was approximately 2,200 prisoners in 2014, representing 0.1% of the total population. In the recent years, from between 2005 and 2009, we conducted 4 cross-sectional biobehavioral studies in prisoners, and we didn't find any HIV-positive cases. But from the results, from the last study conducted in 2009, the prevalence of hepatitis C was 22%, syphilis was 6%. According to the risk behavior, the participants injected drug use was 28.1%, and only 1.1% had access to sterile injected equipment. The contact use was low, only 27.1%. Just informative about the general population in Macedonia. According to the regular surveillance system in Macedonia, we have registered 942 cases in the last 10 years. We registered on the individual cases of syphilis, and HIV prevalence in the general population was low, 0.008. What was the objectives of the study? The objective was to estimate prevalence of hepatitis C, HIV, and syphilis, and to determine risk behaviors toward HIV, STIs among prisoners in order to apply preventive measures. We conduct cross-sectional biobehavioral study compressing 2 components, biological component and behavior component. According to the biological component, we estimate prevalence of hepatitis C, HIV, and syphilis, and according to the behavioral risk, we exploring the injected drug use and condom use. The study was conducted from January to March 2014 in the largest prison in Macedonia, Idrizovo Skopje, which in that period in the prison was settled 1,050 prisoners. We included 200 participants in the study. The sampling was based on expected frequency of hepatitis C. We choose 16.9% of participants of each settles, of each closed settings, and sampling was with probability proportional to size. The inclusion criteria was to be imprisoned at least 6 months in the closed setting and to participate in both in behavioral and in the serological study. The response rate was 100%, and according to the social demographic data, the male was 30.5%, and the mean age of the participants were 36.5 years. For behavior data collection, we performed face-to-face interviews by trained interviewers. We used structured questionnaire on HIV and STIs knowledge, attitudes, and practices such as condom use, injected drug use, availability to sterile equipment. According to the serological data, we took blood samples from each of the participants, and we use ELISA method for detection of HIV antibodies and hepatitis C antibodies. For confirmation, we did an immunoblood test. TPHA method was used for detection and confirmation of syphilis. The study had ethical approval provided by the Ethical Committee of Macedonia. The participation was voluntary, without included any form of compel. At the very beginning of the study, there was informed consent for the study participation, and we used the principles of confidentiality and anonymity. Some of the results. The biological survey showed that we still didn't find any case of HIV. The prevalence of hepatitis was 35.5%, and we find only 2 cases of syphilis, which means 1% prevalence for syphilis. According to the behavior characteristics and positive answers related to injected drug use, 44 of the participants, or 22% of them, injected drug even before imprisonment. 8% inject drug while serving current prison sentence, and of them only 7.1% always have access sterile needles and syringes while serving in the prison. Although 95% responded that there was availability to the methadone program, in the methadone program participate only 26.1%. Because we find the prevalence, high prevalence of hepatitis C, we did analysis of hepatitis C status and injected drug use, and we found that the exposed to the injected drug use was 80% instead of those that did not use drugs. So the risk of those who was exposed to the injected drug use was 4 times higher. According to the biobehavioral characteristic related to the condom use, only 8.6% regularly used condoms during their sexual intercourse. 19% used condoms during last sexual intercourse, and even 37.4% never used condoms during sexual intercourse. Few limitations. We choose only 1 prison that was a limit for the possibility for generalization, and also we have the social desirable answers because of the risk behavior in the prisoners. What we can conclude that hepatitis C prevalence increased by 61% compared to 2009, which suggesting the risk practices in drug injection. Although HIV infection is still not recognized, but the risk of HIV, other bloodborne diseases, and sexually transmitted infection remains significant due to lack of condom use and no access to sterile injected equipment. What we can recommend to intensify educational and preventive programs, to initiate and to introduction of needle exchanging programs regarding safe injected practices, to promote of enrollment to drug substitution treatment, to strengthen the availability and provision of free condoms, for example, with placing the condom-free machines, and to strengthen the peer leader in transferring educational information for HIV, bloodborne disease, and sexually transmitted infection, but because it is always useful in prison. Thank you very much.
Thank you, Kristina. Is there any question from the audience?
Yes.
Carl?
Yes. First, a reflection that I mean, it was quite surprising to me that there was 0 cases of HIV. So I think to congratulate to this good situation. I noted that it was funded by the Global Fund to Fight AIDS, Tuberculosis and Malaria, and my question, although it's outside the scope of this study, if you also have some data on the tuberculosis situations in the prisons.
Yes, we have, but I don't have here.
Okay, thank you.
Other question? Maybe regarding the fact that you didn't find any HIV case, because you calculated the sample size based on hepatitis C prevalence.
Yes.
Do you think
that
maybe...
I didn't mention, but that's a kind of limitation because we use that for sampling. We found the study was for HIV, but we found hepatitis C, so we use that.
Okay, maybe if the sample had been bigger, do you think you could have found some cases? But you say that the prevalence of HIV anyhow is very low?
I don't think so.
Other question, comment? Adela?
Thank you very much for the excellent presentation. We were also very positively surprised by the fact that there is no HIV case. And then we were discussing that then the preventive measures are still even more important if in the network of injecting drug users there is still not HIV. It's really important to prevent that it happens. So we were discussing how does it work in the prison? Is there already any sort of needle exchange program or methadone? How does it work in prisons?
The program is existing, but not the exchanging program, not the program for that. It has to be introduced, but it's political decision, I think.
And access to condoms?
And access to condom is free, but not by the friend. But it's not. I don't have these results, but it's not so discreet. So it's have to be with maybe with the machines. It would be more discreet to use them.
Other common question? Kristina, did you ask the persons if they were aware of their status? For instance, the person who had hepatitis C, did they know that they were?
We asked them if they know how is the mode of transmission. Do they know that it could be transmitted by exchanging needles and syringes? So only 44% of the prisoners answered that they know that.
Okay, but the one who were infected, did they know that they were infected?
No.
No. Okay, so that was a discovery for them also. Okay. Any question, any comment? Okay, thank you, Kristina.